something that's really important. So when you do this type of dialysis, is to make sure that you also take your laxatives, because laxatives can help you if you have any constipation. So if you do have constipation, then this type of dialysis is not going to work very well for you because the stool inside your stomach can press against the catheter and stop it working properly. And when that happens, your catheter can keep on beeping throughout the night, so it can really disturb your sleep for the whole night and make it awkward and difficult to, do your dialysis. So I just wanted to show you the setup. So you can see that it says hello and then your name, and then you can press the green button and then it'll start connecting to the network. So it's connecting to the modem, which it sends all your figures to the dialysis center for you, so you don't have to do it manually. And at this point, I'm going to go off and go and wash my hands using the 5-step technique. I have to go downstairs to wash my hands because I don't have a sink or bathroom upstairs. So if you do go downstairs, make sure you wash your hands and then you don't touch anything at all when you're coming upstairs, because that can obviously ruin the whole hygiene experience that you need for this. And you need to be your hands need to be extremely clean so that there's no germs on them or anything. So now I'm back again and I can start ripping open the packs of peritoneal dialysis fluid. And these covers are really strong in order to keep anything out of the peritoneal dialysis fluid bag, so there can't be any punctures in there or anything like that, otherwise it can compromise the peritoneal dialysis fluid. And if that fluid goes into your stomach, then it can cause things like peritonitis. Peritonitis is an awful thing, and it's extremely painful. So the fluid, if it's infected, it can infect your peritoneum, and it essentially scars your whole peritoneum when that happens. So you have to get really a lot of treatment for that, which is just antibiotics if the peritonitis is in its beginning phase. However, if it's very advanced, then you may have to stay a couple of weeks in hospital and get some advanced care. And it may even mean that you have to stop doing peritoneal dialysis. If there's too much scarring, you can get sepsis as well. It can lead to death and organ failure. So again, peritonitis is something to be really avoided in this dialysis, which is why you have to be very clean and hygienic. And you can see now that I'm just inputting my weight. So my weight is typically 2 kilograms less than what I bought on the machine. So if it's 85.8, then it's actually 83.8, because I've got 2 liters already in my stomach from the morning. And you can input your blood pressure as well. So you probably saw me as well pressing the bags. So I was pressing the bags to make sure that there weren't any leaks or anywhere that bacteria could get into the peritoneal dialysis fluid. So now you can see I'm just opening the cassette, and the cassette is like the brain center of the machine when you connect it up. So it normally directs fluid from the peritoneal dialysis bags into your stomach, and then also is responsible for the drainage of the peritoneal dialysis fluid from your stomach and into the drain bag. So it has a lot of functions. And so before I begin, I just want to close all the clamps to make sure there's no leaks or anything whilst the machine is being prepared. So while the machine is doing a self-test to make sure that everything's in the right place, I'm just going to get the drain bags in place and ready to be set up. So in the drain bags, you want to make sure that these big, large clamps are closed. Otherwise, the fluid from the drain bags will leak everywhere. And there's about 15 liters of fluid, potentially, which can collect in the drain bags. And you don't want that leaking out everywhere, over the floor and on your carpets or anything. So I've got some Y connectors now, and I'm connecting those to the drain bags to be ready to connect to the machine line bags. So you can see I'm connecting the Y connector now to the line on the machine. And I can just keep my drain bags on the side at the moment whilst I'm preparing the rest of the machine. And so at this point, I'm going to go and wash my hands again using that 5-step technique. And so I'm back again now, gelling my hands to make sure that they're sanitized and there's no bacteria on them. If you do forget sometimes to wash your hands, not that you should, but if you feel like nervous or anxious or like you've forgotten something, it's always best to just gel your hands anyway, just in case. So now I'm going to take the tops off the peritoneal dialysis bags and connect the lines from the machine to those bags. And during this point, you want to be extremely careful that you don't touch the tops of the lines or the peritoneal bag openings, because this can mean that infection can get into the peritoneal dialysis fluid and into your stomach. And as I said, it's probably a lifelong lifelong aim not to ever get peritonitis. So this is extremely important. If you do find that you do touch the ends of the bags, then make sure that you throw that bag away and use a different one. Or in the best case circumstances, throw everything away and then start again, just so that you can avoid that peritonitis. And before each connection, you'll notice that I'm gelling my hands to make sure there's no bacteria or germs or anything on my hands before I connect the lines to the bags. Peritonitis, I wanted to mention that peritonitis is extremely fast acting. So if you see any cloudy drained fluid in your bags, you'll probably be told this as well, but if it's cloudy when it comes out of your stomach, then you must call the nurse straight away or the doctor who's on call, even if it's at night, in the morning, or like at 2 or 3 a.m. Just make sure you phone whoever's on call and tell them and bring a sample of your drain fluid, because even in a few hours, peritonitis is extremely fast acting, so it can mean that you could be septic or have a lot of organ failure by then. Uh, so as soon as you see it, just call them and they'll give you a course of antibiotics to help clear that. If it does get to the point of organ failure and sepsis, obviously you'll probably have to stay in the hospital for a couple of weeks. And again, your peritoneal dialysis may have to be discontinued. So now you can see I'm just breaking the seals from the peritoneal bags in order to let the fluid through the bags and into the lines. And you can just give them a little wiggle. This is a trick that one of the nurses told us about, that you can do to let the fluid pass through more freely. And it also ensures that your machine won't keep beeping because there's some kind of blockage in the lines. So now you can see I'm going to place the drain bags underneath my table. I've kept a tub underneath the table so that if there's a leak or anything, the drain bag fluid leaks into the tub and not onto the carpet everywhere, and ruins everything. And I'm just going to keep a connection shield in place before I prime the machine, so that when it's primed, I'm ready to connect myself to the machine. You can see on the wall here, I just wanted to show that I've kept some documents on the wall, and they are to tell me the instructions of how to do PD dialysis. So they're all laminated documents, and they give a step-by-step, they give step-by-step instructions of how to do PD dialysis. So if I ever get stuck, or I forget to do, or how to disconnect to go to the bathroom, or if I forget how to disconnect early if I need to, then all that's on the wall for me. After doing this for 2.5 years every day, I think I can do it blindfolded, but it's just there in case. And again, it's very important that you don't skip any steps while setting up the dialysis machine, otherwise it could lead to infection, again, peritonitis. So it's extremely important that you keep following all the instructions every single time. The hand washing, gel sanitization, everything, sterilizing your whole dialysis area before beginning as well. So you can see now I've connected all the peritoneal bags and the machine is priming. And when it's priming, it just means that it's going to flush some fluid through all these lines and make sure that there are no air bubbles or there's no kind of obstruction in the lines, in order to do dialysis properly.